with individuals and businesses. Do you know how many charges have been laid? 2. That's 2 out of nearly 3,000 interactions over the course of several months. And that's not because of a reluctance to issue fines or lay charges. We're well beyond that point of education. Rather, it's because compliance has been exceptionally high and essentially universal. That's what's so very frustrating about the record high case counts we've seen over the last few days here in London Middlesex. Small businesses and local establishments are doing everything we've asked of them. People who frequent these locations, at least while they're there, are also obeying the rules. We know this to be true based on what I've just detailed. Despite that, it's clear too many people are not following the rules and not following health protocols when they're in private residences. And that's on all of us. All Londoners, regardless of age, must pay mind. They must follow the health protocols in those private residences, because it isn't just a younger person problem. This is on all of us again, regardless of age. Here's the reality. For anyone who becomes infected with COVID, your own personal health aside, you know what impacts the most? It impacts our most vulnerable. I'm thinking of your grandparents, those with underlying health conditions, those living on the margins in our community. You know what else this impacts? Small business. Higher case counts impact consumer confidence, and depending on how high we go, could lead to provincially mandated shutdowns. Those who are vulnerable, along with small businesses, are doing what they can to avoid spreading the virus, yet they're the ones who bear the brunt of other people's foolish recklessness. It's unfair, and it's unconscionable. They deserve better, and we need to be better. The good news is still within us to control, and it's not hard. There's nothing new here. Wear a mask, wash your hands, avoid large crowds, and limit your social circle. And the sacrifice we're being asked to make is, even if we can call these public health guidelines sacrifices, are nothing at all like the ultimate sacrifices made on behalf of us by men and women in uniform. Sacrifices we'll remember on Remembrance Day this Wednesday. If you haven't already, buy a poppy, wear a poppy, and remember them. Remembrance service ceremonies at the Cenotaph in London will look much different this year compared to prior years. For starters, it will be less than 25 individuals, and it's by invitation only, although you'll be able to watch the service on local media outlets. Even still, there's nothing stopping you from standing at your workplace or at your home to observe 2 minutes of silence at 11 a.m. And I strongly encourage all Londoners to do just that. There's nothing stopping you from wearing a poppy or telling a loved one who has served how much that service means to you and our country. I truly hope everyone takes time to appreciate and to remember the sacrifices made on our behalf by these brave men and women, and use that sacrifice as a source of inspiration in the weeks and months ahead. We will remember them. Over to you, Warden Cathy.
Great. Well, thank you very much, Mayor Ed. It's great to be with you this afternoon. I really don't have much to report on today because I know that we're all anxious to hear from Dr. Mackey on this beautiful Monday afternoon. My goodness, let's all get outside and enjoy the sunshine while we can. But I do have a couple of things, and one of them jumps off of just what Mayor Holder was speaking about Remembrance Day. In the county, as I shared with you last week, Remembrance Day will look very different in our municipalities. And we are encouraged to attend our services in our local municipalities either virtually or pay your respects privately. As the mayor said, there's nothing to stop us from standing at our desk at 11 o'clock and observe 2 minutes of silence to reflect on those that truly did sacrifice for our country. Please buy a poppy. There's poppy boxes out there, and although there's no street campaign this year, the Legion still does need your help, and they still do need your support, and that poppy fund will stay directly in our communities to help veterans. So please buy a poppy. Just a friendly reminder too that it's important to remember that these services that are being organized in our communities are all being run by volunteers. And they're doing their best to present revamped services while respecting the guidelines that they have in front of them. So please be kind and understanding, knowing that they've had to adapt what they're used to presenting to communities. If they ask us not to attend and they are giving us an option to watch virtually, please take them up on that. As the mayor said, I've seen in our own communities people following proper protocols. I was out at a couple places over the weekend throughout the county, and certainly people are respecting masks, they're respecting distances, and they seem to be respecting their social bubbles. But there's no question COVID is still in our community, and somehow it's still being spread. So please be mindful of always being socially distant. Wash your hands. If you are ill, please stay home. And if you are showing signs and symptoms of COVID, please get tested. Remember, mask up, and we will get through this. Dr. Mackey.
Thank you very much, Mr. Mayor and Madam Warden. Those inspirational words are much appreciated, and I think they're what all of us need at this stage. It is a difficult time right now. We have very high case counts. There's no way of sugar counting that. An additional 20 cases today. We broke records here twice over the past week and at the provincial level as well. We're deep in the second wave, and things don't have any, there's no indication that they will be abating in the short term. Nobody wants to get back into a lockdown situation. That's what we all need to work to try and avoid. And at the current trajectory, that seems like it is possible. If you'd asked me a couple of weeks ago, I would have said we're pretty far off from that. As it is, if we need to absolutely double down on our efforts, or that might come back into the picture as a possibility. And I'm going to pause there. Look forward to any questions.
Thank you, Dr. Mackey. Thank you, Madam Warden. Thank you, Mr. Mayor. We do have a lot of questions already in queue, so let's get to those right away. Dr. Mackey, the first question is for you, and it comes from Steve Young at CTV News and News Talk 1290 CJBK. Dr. Mackey, as we know, about 2,000 anti-maskers demonstrated in Helmer on the weekend. From all accounts, most of the people protesting were from London. Is that concerning from a potential COVID perspective locally?
Well, there's no way that that sort of thing would be a good thing. I mean, to see thousands of people come together with the specific purpose of violating masking and other public health regulations is really concerning. I know that the mayor of Helmer was doing what she could to try and address the situation. And unfortunately, those protests continued. We're not at the point of a police lockdown sort of situation, so I understand why those crowds weren't broken up. And of course, people have their right to express their opinion. It's just really dangerous for themselves and potentially for all of the communities served by London and Middlesex as well.
Thank you, Dr. Mackey. We do have a follow-up question from Steve Young. But Dr. Mackey, with 20 new cases today and 37 from Sunday, do we run the risk of tighter restrictions? Will that happen if the daily number climbs to over 40?
Well, the province has a framework in place. If you look at the high case counts that we've had over the past few days, it seems quite likely that the province would make a decision to move this area to a higher level of restriction sometime soon. One thing we don't exactly know is the process by which the data is considered. If you're using data that's a week old, you would have missed all of those record-breaking days. But if you're able to use the most recent data, then it becomes clear we're at a pretty high level of spread compared to where we were, 2 weeks ago.
Dr. Mackey, the next question comes from Andrew Graham at Global News Radio, AM 980 CFPL, and it kind of picks up where you just left off with the question from Steve Young. Dr. Mackey, Andrew asks, due to London's high individual case counts in recent days, do you anticipate any change this week within the Ontario's new tiered COVID system? We're currently in green prevent. Could that be increased to yellow protect? And if so, how would that differ from the guidelines and restrictions we were under last week?
Thanks for the question, Andrew. I certainly do anticipate the province will look closely at our numbers, and it's hard to see how the case counts that we have would not qualify for the protect level. But again, that's a decision that happens on a weekly basis at this point, not daily. So probably something would go into effect either later this week or maybe on the weekend. But also we don't know for sure. There are 5 different criteria that the province is using to enter into the protect level. It's not just case counts, it's percent positivity, reproductive number, which is, how do your cases this week compare to your cases last week, and a number of others. So it doesn't make it so that it's so crystal clear that you can say for sure we're moving into a higher level. But from our view, we do meet the criteria, and we would expect the province to make that move later.
Thank you, Dr. Mackey. Well, let's move on. Our next question is from Jane Sims at the London Free Press, and it is for you, Dr. Mackey. Dr. Mackey, even though we are seeing more cases, the most recent data on your website indicates we still have a low positivity rate after testing. As of October 25th, 0.06% of tests come back as positive, compared to 3% across the province. My question is twofold. 1, are we doing enough testing? And 2, are there perceived barriers in place that are stopping folks from getting tests?
Yeah, so the percent positivity, a lower percent positivity would actually suggest that we're doing lots and lots of testing, particularly people who are at low risk. If we had the issue with the percentage positivity, so it's positive tests divided by negative tests, divided by total tests. And if you're testing a lot of people who have no symptoms, then that would push your positivity down. If you're not testing enough people, you actually would tend to see a higher positivity rate, because only people with symptoms are likely to be going to get tested, and that tends to push your positivity rate up. A case in point is this community and others during the first wave. When tests were limited during wave 1, the tests went to those who were at greatest risk, elderly, people in long-term care, that sort of thing. And so you had a much higher test positivity in wave 1. Not necessarily that there was more virus spreading then than there is now, but that we were testing those that were more likely to test positive. So this is certainly not an indication that there isn't enough testing in this area. It's likely in part a factor of the fact that you have to test people in long-term care, staff and visitors that are allowed to go to long-term care facilities. So the fact that we have a lot of long-term care facilities in this area means that there are a lot of those, every 2-week tests coming back, and those are, almost always negative. So you've kind of diluted the pool of tests with a lot of low-risk tests.
All right. And then, Dr. Mackey, any perceived barriers in place to stopping folks from getting tested?
At this point, we have great testing infrastructure. The wait time at Carling Heights is very low. It's pretty easy to get a same-day test. A family friend went in last week, got a test within 20 minutes. We also have testing in a number of pharmacies across London. Would love to see more testing available in the county, but we know people in the county are getting tested as well. We have done many tests for those who reside in the county. So at this point, it's not like testing for COVID is as easy as doing a home glucometer test, but it's getting easier and easier.
Thank you very much. And a follow-up question from Jane Sims. Dr. Mackey, do we have any clearer picture where the infections are coming from? Given the number of school cases, are you looking at what's happening in education and suggesting more protocols or restrictions to stop the spread?
I really appreciate the question, Jane. First of all, no clear picture of a single point of cases in the community. It's not like we have a large mass, outbreak that's dominating the case picture. These are really coming from across the community. Taxi drivers, restaurant workers, people who do Uber, long-haul truckers, anyone with a significant public exposure or travel risk seems to be generally at higher risk. But beyond that, about ballpark a third of the cases are among those whose family members have tested positive. Very difficult to stop the spread of this illness within a home. And then the other source, we have about a third of cases that are unexplained. That's ballpark. And it changes obviously day to day. But all of that to say that this is something that's very widely distributed. And, you know, we did have signals from across the sewage wastewater testing about a week ago that showed a similar picture. COVID-19 was really showing up in significant numbers in sewage across London. And we know that represents what's happening in the county to a certain degree as well, although not as perfectly as it could. So, and then the other part of that question, sorry, it's just gone over to publish, so I've lost it. The other part of the question is about schools, and really glad that you asked about schools, Jane, because what we're seeing in schools in almost every single case is you're seeing people testing positive, students testing positive, who have a good reason outside of the school to be tested positive. In other words, generally it's a family member who has tested positive and passed it on to their children, or you know, they may have exposure in some other setting where we know that there are positives. There are a very small number, really only 1 or 2 situations where we've seen transmission that is likely to be attributed to the school environment. So it's not that students are getting COVID in schools and then testing positive. It's that children are testing positive because there's virus in the community and they happen to be children that attend schools. So at this point, we're pretty happy with how things are being implemented in the schools. Glad we can identify some of those students that are positive and reduce, you know, identify their contacts, make sure that there is no spread in the schools, but we're not seeing much spread in the schools at all at this point in this region.
Thank you, Dr. Mackey. Rebekah Rodriguez from the Western Gazette has a couple of questions, and I think what I'll do is I'll combine them because I think they go together quite well. Dr. Mackey, were any of the 37 COVID-19 cases reported on Sunday connected to outbreaks? And also, can you tell me if any of those cases are Western University students? And if so, how many?
Yeah, so at this point, Rebekah, we've had on the 37-day, 3 of those cases were students linked with the large house party on Halloween. They weren't Western students. They were post-secondary. Other than that, we haven't seen any outbreaks in students, any new outbreaks in the student population in some time.
All right, thank you very much. Let's go to our next question. Dr. Mackey, it comes to us from Grant Demi at MyFM Radio in Strathroy. Dr. Mackey, is there any indication, and you actually just answered this a little bit, is there any indication this weekend's numbers are connected to Halloween?
Yeah, you're right, Dan. That is the only strong connection we have with Halloween at this point, is those 3 cases that were connected to the large house party. Other than that, we haven't seen a direct link with Halloween. Clearly, it could be playing a role in some of the spread that is increasing across the community, but that's not the only definitive cases are those 3 at this point.
Thank you, Dr. Mackey. And we did get another question from Rebekah Rodriguez at the Western Gazette. Dr. Mackey, university students have returned to London after Reading Week. Do you expect that there will be an increase in cases in the next few weeks as a result?
Yeah, so Reading Week is another big X factor. It really depends on what sort of activities people were involved in during Reading Week. Were they out partying and in close contact with others? If so, that definitely could lead to an increase of cases. If they were home actually reading on Reading Week, which not all students do, I understand. But if that was the case, then we could see a pretty minimal impact.
Right. Jane Sims is back in with another question, Dr. Mackey. Additional restrictions were put in place by Peel Region's Medical Officer of Health over the weekend on top of the province's restrictions under the new framework. Are you considering any more local orders for Middlesex-London?
Yeah, we're not considering at this point additional orders in Middlesex-London. We have a framework that will be very useful, I think, across the province. some, outstanding questions about exactly what impact the framework will have long term. But at this point, I think it's a really useful document, and we definitely are standing beside and behind that framework at this point.
All right, thank you, Dr. Mackey. We're going to move down a little bit. Andrew Graham, are you able to provide an update in regards to the workplace outbreak at the London Fire Department?
Sorry, that's for me.
Yes.
I don't have additional information about the London Fire Department outbreak at this point.
All right. We did get a follow-up from Rebekah Rodriguez. Dr. Mackey, can you confirm if the 3 cases, and I'm thinking these are the post-secondary cases you mentioned associated with that Halloween party, are from Fanshawe College or affiliate colleges at Western?
Yeah, my understanding was those cases were Fanshawe students, but the party probably had students from a number of different universities and colleges involved.
Okay. Jane Sims has a question about the wastewater testing. Dr. Mackey, at this point, my understanding is that those University of Windsor tests are done once a week. Any chance that the pilot project will be expanded, and will the results be added to the Health Unit's website dashboard?
Yeah, we're definitely looking at those results. They're not our results. They really belong to the University of Winnipeg. Sorry, Windsor. I went to the University of Winnipeg. That's a long time ago now at this point. University of Windsor and to the City of London. So it's really up to them how they'd like to share that information. They certainly have given us, permission to talk about those things. But it's still very much in kind of an experimental phase. The protocols keep getting adjusted based on what they're learning about water samples. So it's not the sort of indicator that we would want to, in terms of a proven track record at this point. It's a really useful number to look at and to watch the trends, but it isn't necessarily definitive. When we look at where our strategy is, it is really about reducing cases and reducing deaths, hospitalizations. Those are the things we focus on reporting.
Thank you very much, Dr. Mackey. And that brings us to the end of our questions. Dr. Mackey, Madam Warden, Mr. Mayor, thank you so much for your time again this afternoon and for sharing your insights and your information with us. I'd like to let everybody, just as a reminder, that our next virtual media briefing will be held on Thursday at 2 p.m. So between now and then, enjoy what weather we still have available that makes it feel like summer in November. Don't forget to observe Remembrance Day as you can, and for most people that'll be virtually, and there will be opportunities to stream the ceremonies from London, so do look for those so that you may mark your respects and remember them. Have a great rest of the day, and we will see you on Thursday.